Thank you all for joining us. I'm Deborah Hurston, the Executive Director of ABEP. And as you may know, June is recognized nationally as Men's Health Awareness Month. At ABEP, we strongly believe that health is a major component to realizing true economic power. Shay Sandifer, who is the CEO of the new MPLS, and who was recently recognized by the National Association for Women Business Owners as one of the top 10 business owners nationally, is leading our important discussion today as we take a look at the facts surrounding men's health and the challenges surrounding men's health as well. So at this point, I'd like for Shay to take it over.
Okay, thank you. Welcome, everyone. Happy Wellness Wednesday. Like she said, I'm Shay Sandifer. I'm pleased to be here. I'm your monthly moderator for APEP's wonderful in-person and virtual events. And this is near and dear to my heart, Black facts about health and awareness of that. I love it. I breathe it. I have health equity companies that focus on that. And it's all started with my own health and then moved into how we could better the community. And so I'm blessed to be here and be able to share this with you and others, what's going on. So we have three amazing distinguished speakers. We have Lucienne Olson from Revival Mentoring, Dr. T. Johnson, and Dr. Thompson from Healthy Living with Vision Foundation. Welcome.
Thank you very much.
Oh, thank you. Thank you. So I just want you to real quick say in a brief what you do and what you specialize in. Lucienne, we'll start with you.
Hello, everyone. It's so great to be here and be in the room. I am Lucienne Olson. To put it simply, I am a health and wellness professional. I do a little bit in fitness. I do a lot of nutrition and a lot more around lifestyle coaching, helping folks understand what it means to live a healthier lifestyle by their terms, on their terms, as it looks in their day-to-day life.
Thank you. Dr. Thompson?
Hey, thank you. Good evening, everyone. I appreciate the invitation to this venue. I'm very excited about the topic. My name is, as stated, Dr. James Thompson. I'm a native of Chicago and a board certified allergist and immunologist. I've been in practice for 34 years. I am able to see all ages, so I've been able to see a lot of families grow up. I'm also a certified integrative nutrition health coach about 7 years now. So I've integrated that into my practice. I'm also a medical director for Healthy Living with the Vision, whose CEO and founder is with us tonight. And I am on the board of Growing Home Incorporated, located in Englewood, Chicago, an urban farming community, which I also enjoy participating in. Thank you.
Thank you. And last but not least, Dr. Johnson.
Well, good evening, everyone. And it is always a huge blessing and a privilege to share some knowledge with our community on eye care and other things, health issues that we're a part of. My name is Dr. Ansel Johnson. I'm clinical director of Vision Salon Eye Care Associates. We are a independent primary eye care facility in suburban Chicago. And I'm also an adjunct professor at about 5 colleges of optometry. So we have our hand in training the next generation of eye care providers. I'm a member of the Association of Diabetes Care and Education Specialists because we have a special interest in preventing and reducing vision impairment from people living with diabetes and also borderline or pre-diabetes. As Dr. Thompson, my esteemed colleague, mentioned, I am CEO and founder of Healthy Living with the Vision Foundation, where our mission is to eliminate healthcare disparities in historically underserved communities. So it's a pleasure being here.
So a few housekeeping, please keep your computers or your phones Thank you. And if you have questions, feel free to put them in the chat and we will ask them and we'll be able to talk and open up the floor to questions in a bit. But Dr. Thompson's going to start us off with a great presentation of about 12 slides. He's just going to go through over like 5 minutes about some important things about health. And then we're going to dive into some questions with the whole panel and be excited to listen to what we can learn and incorporate into our daily lives. So Dr. Thompson, if you could take over, that'd be great.
Good. So I am excited to be here. Good evening, everyone. Thank you for giving me this opportunity to join these distinguished panelists in discussing the state of Black health in the U.S. While some of the information I'll provide might be concerning, there are also some positive aspects and opportunities for improvement that I'm eager to share and discuss. First, let's address the life expectancy gap between Black and white individuals. On average, Black Americans live to about 71 years of age compared to 76 years for white Americans. Now, this gap is even more pronounced when we look at gender. Black women live to 75 years of age on average, while Black men average about 67 years. And that's sobering information for me because I'm 66 years old. In comparison, white men make it to 74 years of age and white women live on average to 79 years of age. So you might ask, why is this? Well, here are some possible explanations. Heart disease remains the leading cause of death in the US, even during the peak of the COVID-19 pandemic. African Americans are 30% more likely to die from heart disease than whites, and are also more likely to have uncontrolled high blood pressure, a major risk factor for heart disease and strokes. Rates of high blood pressure are higher among young Blacks, with a 4% higher incidence between those ages 18 to 34 and an 11% higher incidence between ages 35 to 49. Diabetes also disproportionately affects the Black community. Between ages 25 to 49, 10% of Blacks have diabetes, compared to only 6% of whites. Cancer statistics reveal even more disparities. According to the American Cancer Society, African Americans have the highest death rate and shortest survival for most cancers. Black women are 41% more likely to die from breast cancer than white women, despite fewer diagnoses. Black men are 1.7 times more likely to be diagnosed with prostate cancer and are 2.1 times more likely to die from that disease. Colon cancer also disproportionately impacts Black Americans. We have the highest incidence and mortality rates of colon cancer. We are 20% more likely to get the diagnosis and have a 40% higher death rate compared to other racial groups. It doesn't get any better when we talk about kidney disease. Chronic kidney disease is another significant concern. Although African Americans make up roughly 13% of the population, we represent a third of the patients on dialysis for kidney failure. So connecting some of the dots here, we see the leading risk factors for kidney failure are high blood pressure, diabetes, lupus, and other autoimmune diseases. If I had more time, I'd also discuss disparities in maternal mortality and childbirth, infant mortality, and mental health, but I don't have more time. The COVID-19 pandemic has further placed a spotlight on health disparities. African Americans are experiencing more severe illness and higher mortality rates from COVID-19 compared to whites. This is for a large part because COVID-19 has a predilection for individuals with underlying conditions like hypertension, obesity, diabetes, and high cholesterol, conditions that are more prevalent in the Black community. The information on the previous slides paint a challenging picture, but also underscores the importance of addressing these health disparities. If you've been wondering, when am I going to get to the positives? Well, here we are. Though the stats I provided on cardiovascular diseases and cancer were abysmal for Blacks, over the past several years, the rates of decline in some of the major cancers in African Americans has outpaced other ethnic groups. Heart disease deaths have dropped 43% from 1999 to 2015. Cancer deaths dropped 29%, and stroke deaths were down 41%. Some of this has been attributed to decreased tobacco use and increased insurance coverage, perhaps Obamacare. But the COVID-19 pandemic has walked back some of the declines of the previous years. Well, thank you for your attention, and I look forward to discussing how we can move forward together.
Thank you, Dr. Thompson. That was great. So let's all take a deep breath. Right? Because we got some work to do, but we know it can be done. And it starts with showing up for conversations like this and taking the first step and major step is you taking control of your health. And I thank you all for showing up because you got to do your due diligence. I today was at the doctor, got my breast exam and following up. So yes. So they gave me the Tata's high five as they did. So it's a big thing though. I've had 7 aunts that have passed from breast cancer on my dad's side. So I'm over, I think I hit like 55% and then I'm doing genetic tests. So I learned a lot today. So this is a great segue into this. So I am going to start with you, Lucienne. The doctors and Lucy, you guys can start off. So it's Men's Health Awareness Month, and then particularly we're talking about Black men. What do you feel as they're coming in there, right? You're seeing usually men at like maybe their heaviest state, they haven't gone to the doctor, maybe they feel comfortable. Where are you seeing them at their health, their current state of health when they walk into you?
Well, honestly, I think a lot of times when people come into me, they might have an idea of what they're looking for based off of what society tells them, or what we hear commonly in the media. But a lot of times, like when someone comes into the gym, you know, a lot of what we're doing is really foundational. It's understanding, it's becoming aware in the simplest terms. All of the exercises in the world as far as being in the gym won't change if you go back to an environment where you can only get so much out of it. So it matters if, you know, if I have someone come in and maybe they're overweight, I'm missing a mark if I'm not talking to them about, you know, having healthy food to eat, having access to, you know, a safe neighborhood where they can get outside and walk around, depending on what their lifestyle is like, what their stress is like, day to day. Just really pulling back and pulling back the layers, because I know for a lot of men in specific, getting vulnerable, really addressing some of those layers of stress, some of the things that play on us every day. It takes a second to kind of get aware, and maybe just acknowledge some of the things that play on us and weigh on us every day.
Thank you. Dr. Johnson, kind of the same question for you too. As a Black man, you're probably seeing a lot of Black men that feel comfortable to come to you. Where are you seeing their current state of health? And then how are you living by example too, to tell them, you know, like this is what I'm doing if they're like afraid to do some things?
Well, my story is a little unique because I have lived through, and I am living through living with diabetes. And I share with a lot of men my stories. I'm also a prostate cancer survivor. So as I talk to them about the eye stuff, and I always say we connect the dots between your eye care and your overall health. And it's a lot more than just, okay, where can I get the cheapest glasses at? And unfortunately, in our community, that's the perception of eye care. Okay, I can get the cheapest glass, I just need to see and keep it moving. And I really spend a lot of extra time connecting those dots. So we have there are 3 kind of bullet points, the most common things with eye care that I talk about. One is cataracts, and cataracts is a clouding of the lens, that camera lens behind the pupil of the eye. And it's a normal aging change for all of us, just as if your hair turns gray, if you see a few more gray hairs over time. And with cataracts, that can happen, although there's a number of things that can cause one to develop cataracts at a younger age. One is diabetes. Those fluctuations in your blood sugar can cause that lens to become clouded much more quickly. Several medications. When people are on anti-inflammatory medications for autoimmune disease, steroids, systemic steroids that they take by pill, that can cause cataracts. Exposure to the sun. So a lot of us Black men, you may work, say for the electric company, and you're out on the poles and you're outside a lot, or if you work for a construction company, you're outside a lot and don't have really good sun wear protection in your eyewear, whether you need a prescription or not, and you're outside a lot, that can increase your rate for developing cataracts. And diet, and as I mentioned, fluctuating blood sugar, medications, things of that nature can cause the other thing that that afflicts our community a lot is glaucoma. Glaucoma is a family of eye diseases that cause damage to the nerve fibers that connect the eye to the brain. We actually see with our brain. So the back of the eye, those nerve fibers are very delicate. And it's connected to not only to the fluid pressure in the eyes, because a lot of times people get that little air puff and they think that's the glaucoma test, where testing for glaucoma, especially early, is a lot more involved with that. That fluid pressure inside the eye can cause damage very slowly over a number of years and cause people to lose their side of peripheral vision first, where the clear vision straight ahead is the last to go. So we as Black men, you know, we're used to grinding, right? So we just keep it moving, keep it moving. If it's not hurting, if it's working, we just keep moving. And that's one of the things you don't want to go without getting your eyes checked on a regular basis, because there's no pain, there's no blurred vision early on. By the time you notice something subjectively, something's not quite right, that person may have tunnel vision. Whatever they lose, they can't get back. You can lose your driving privileges. I have a lot of patients, a number of patients that have 20/20 or just a little bit less vision, but have no side vision. And those people are visually impaired. So, and it's analogous to, you don't wait till the oil light comes on in your car to change the oil. You got to get a regular checkup. So that's glaucoma. And I really work hard to detect it early in people that are more at risk. And then we can deal with early treatment. Is pretty simple with eye drops. And then the last bullet point in terms of the big three, in terms of causes for vision impairment in our community, is diabetes. Diabetes is the leading cause of blindness in adults in our community. And so what causes people to lose their sight from diabetes is bleeding, scarring, and swelling in those delicate nerve and blood vessels in the back of the eye. So some of the things that Dr. Thompson talked about in terms of kidneys, dialysis, things of that nature, those tissues also have very delicate blood vessels. And oftentimes it's during the eye exam, a thorough eye exam, that you can detect these minor changes in the blood vessels before it's an issue, before you see bleeding and scarring in the back of the eyes. And we have great technology, and a lot of it is not standard of care, but we use it all the time to detect and put people in a position where we can detect these changes. And I talked about how I'm a member of the Association of Diabetes Care and Education Specialists, and I'm an optometrist, so my focus is always finding these changes before they become, you get the bleeding and the scarring, and we have to refer you to a retina specialist where you get injections in the back of the eye. So we talk about counsel, we talk about diet. It's all connected, and the blood flow in the back of the eyes is huge.
Thank you. So before I segue over to you, Dr. Thompson, I just want to hone in real quick, Dr. Johnson, when you spoke about that you have diabetes. And so we're going to start talking about a little bit about stress, right? Do you feel, and this goes for both of you, Dr. Thompson and Dr. Johnson, that stress is the leading cause that starts maybe the overeating or non-movement with Black men?
We as Black men, we live in a constant state of stress, right? So, like I said, we just know we got to keep grinding, we got to keep it moving, and that's what happened to me. I knew I was pre or borderline diabetic, but in the back of your mind, and a lot of us in the healthcare field know it intellectually. but we don't walk that walk. And so that's why I share with my patients, I don't want you to go through that ambulance ride to the ER because your blood sugar is super elevated or whatever. That's not a pleasant thing you want to experience, because God could have taken me away at that moment. So so I can relate to that grind, but you got to turn around and take control of your health care. And I had this conversation with a gentleman today. He's taking care of his wife who had a stroke, hasn't checked his blood sugar. I said, you don't want to be there. And so let's talk about doing some small things to take care of your prostate cancer. That's can be related to stress and lifestyle. And I had to change my diet with that. So I have lived and am living through all of these things, and those decisions that you make every day. Okay, did I get my workout in? What am I going to eat? Did I prep my lunch? What am I going to eat the rest of the week? How's my week going to go? I got meetings. I go out of town. So what am I going to do? What am I going to eat? Those little things. Oh, I need to make my doctor's appointments. I know I'm overdue.
Right.
What medication? I need my medication. All of these decisions I relate, and I break it down with my patients. What is your plan? It doesn't have to be just small, consistent things every day. And I don't want to take up Dr. Thompson's time, but I know he can
He's
relate
got some
even more.
things to say. He's ready. So, with that being said, as we're talking about stress, right? First of all, you're a Black man in America, right? So you've got that stress, just that. What are you advising or recommending, Dr. Thompson, for Black men with that stress before we lead into the other health elements?
Yeah, that's a wonderful question, and I fully agree with what Dr. Johnson said. I think this stress is a constant state for us, not only Black men, Black women too, Black
We're
people,
here.
right? And
Black
that's
people.
yeah, I mean, that's one reason why when they look at adjusting for everything, diet, exercise, lifestyle, there's still a factor that puts us a little higher on the list of various health diseases. And it's the structural racism that causes all of us some stress. That goes back to how we got here, slavery, and then then sharecropping, and then Jim Crow, and now it's Jim Crow under the radar that's now coming above the radar. So we're constantly in that. So what do I tell people? Well, certainly we need to try to at least embrace what we have control over. There are some things that we don't have control over. We don't have control over the fact that we have parents that may give us certain risks, but we do have control over how we live and what we do. Like Dr. Johnson, I also had some of these same problems. I had blood pressure problems for 25 years. I won't say I had problems. I had the diagnosis, and I took 3 different medicines. And until I got training in holistic integrative nutrition, I was under the impression from my conventional training that you needed medicine for the rest of your life. Well, I'm happy to say I've been off medicines for about 7 years, all 3, and my cholesterol medicine. By diet, I eat a whole food plant-based diet. I exercise regularly. I try to get as much sleep as possible. It's a multifaceted thing, but I'm gonna tell you,
Right.
diet is a huge part of it, and exercise is too.
All of
So
it.
yeah, it
All of
is.
it.
So stress, I try to get people, the stressors you can eliminate, you try to eliminate. You try to eliminate your stressors. Maybe you always say yes to everything. Well, stop doing that. So don't put so
Right.
much on your plate. But then
Right.
the things you don't have control over is how your body handles the stress. And if you're exercising and eating the right foods, not caffeinating too much, not smoking, not drinking, getting the proper rest, your 7 or more hours, you're going to handle stress better. So I'll leave it at
Right.
that. Okay.
So let's go right into the food,
That was
Lucienne.
good.
Right?
That was
That's
good.
all that she stays on me for, and my fiance somewhere on here is about our diet, right? For years, I had to weigh out food, right? As a bodybuilder, I had to weigh out, take a picture, send it to her, like this is what I'm eating. I know on average, everyone's not going to do that. So, Lucy, that diet, let's talk about that. Like what you're seeing, how people can change it little by little. They're not going to all of a sudden change that whole trajectory that they've been, born into. That's really what it is, right? It's generational that they're seeing that. So, what advice do you give people, and how can we change that?
Okay, so Dr. Thompson, so much of what you said, I want to piggyback on. And because stress, I feel like, is also so much a part of our nutrition, our appetite, our cravings, all of that. It's also like Dr. Thompson said, we can only control our controllables. So if I can only focus on the things that I can control, right, and make it simple, again, just like in all these other areas, like in nutrition, we get so many mixed messages. And a lot of times it's just taking it back to simplify things. So if we get all of these messages about keto and intermittent fasting, and, you know, all of these different things that we can do, I like to tailor back and first teach people the why of like, why is this a principle? Who does it serve? What is its purpose? The second piece though is application, because keto is a certain principle in nutrition. Intermittent fasting, let's say, is a principle of nutrition, even a plant-based diet. But I don't have to take all of them just at face value. I can take and pick and choose what's for me. And a lot of times in my coaching with folks, a lot of people just haven't had the space or been given the time to really apply and see input output. Because if I'm told a certain food is healthy, but every time I eat it, you know, I'm in pain or I have some adverse kind of response to it, it's not serving me. So I like to take people back a lot on the nutrition page and not just tell them what to do, but I encourage them to ask the right questions of like, how did this serve me? How does this look in application? And so again, we can have our overarching principles of like, okay, we want to hit a certain amount of protein every day. Absolutely want to eat from a whole plant-based diet. Then we can kind of layer on from there. But again, going back to stress, it's hard to separate the two, the stress and nutrition piece, and the access piece. There was a lot I wanted to say even about the stress conversation and just the fact that I like to look at health on a mind, body, spirit, kind of like a triangle. So like each side, it requires balance. And so even when we are the most locked in on our exercise routine, or let's say our nutrition regimen, if I don't have quality relationships, if I'm not connected to a source, you know, if it like I can miss in certain areas, and that absolutely affects my nutrition, that affects my exercise. So that was a really long way, but I think all of these pieces are so intertwined, you can't really separate them. If I'm stressed out every day, I don't have an appetite. If I don't have access to healthy food, I'm not going to have the energy the next day to get up and go to the gym. I don't have the mental focus and the clarity to do my work for that day. So they're all just so linked together.
Yes, but diet, she tells me I can't out-train a diet. So I can't go have mac and cheese and then think I'm going to have a six-pack. It's just not going to work. I can't have a few slices of pie if my A1C is high and think that's going to help bring it down, right? You can't drink soda or juice, you know, when you're needing to get your high blood pressure down, you need to drink water. So just little things is huge, right? Like we're not asking people to change everything, but just incorporate a little something, whether it's
And
food,
knowledge is
movement,
power.
and knowledge, right?
I
And
think it's
so
if the more we know, the more empowered we are to go ahead and make educated decisions, and then also, you know, share that with the people around us. And I think when we adapt certain habits and start carrying out certain things, and then the people around us see it, that's the most effective way for change in our communities.
for sure. So I have this question. In the healthcare system, which Dr. Johnson, Dr. Thompson, you both work, where are you seeing the common misconceptions about healthcare, especially with Black men? And you both can answer together, separate.
Sure. I'll go. Yeah, there are common misconceptions. There are, when we talk about healthcare providers, first of all, we're talking about less than 5% of healthcare providers are African Americans. So that leaves room, and we see it, for some lack of cultural competency. So sometimes we'll run against some assumptions, like assumptions that maybe Black men aren't gonna follow a program of taking their medicine, or maybe aren't gonna show up consistently for their appointments. Or there was also this assumption of pain thresholds. We've talked about that in various other venues. That goes for Black women too, but that's also Black men may not get as much pain control when they have various conditions. They may not get certain kinds of services And so those are things we have to work on. And that's something that I think if we focus in on getting more Black doctors into the mix, that would help. But also training the doctors that are there that take care of a lot of people of color and making them more culturally competent. So that's a main thing. And then just access to doctors is an important thing. You know, if you're in a community where you have to go cross town to see a doctor, that's going to be harder, especially for a working man who's trying to, you know, stay at work. We ran into a lot of that with the pandemic. You know, most Black people had service jobs. They didn't have the luxury of taking a laptop at home and working from home. So that added more pressure, more stress, less doctor visits. So there's that. And then there, you know, when you talk about mental health, the stigma that we run into with that. And I think even some Black providers probably need a little training in how we can address that with our own Black males. But at least you're not running into that implicit bias that you see. And that's where with some people of the majority, because of their background, because of their upbringing and training, sometimes they tend to have some prejudices with how they treat other people that are in the minority area. So I'll stop there and let Dr. Johnson chime in.
Johnson. Thank you, Dr. Thompson.
Being an optometrist, there are a number of misconceptions. And let's just start with sight, because that's the one sense that a lot of people are really afraid to lose. So again, we get into, well, I can see, so everything's okay. So a lot of times people, they just try to treat their own issues with, say they have a red eye, they just grab something over the counter to fix it. And there's an assumption that if you have drops that over the counter, it's safe. And that is not true. There have been eye drops just for dry eye that have been recalled that have caused serious and blinding infections in the eye. So you can't always assume, and these are like generic kind of store brand, generic drops. You just can't assume things over the counter are always safe for your eyes. And I tell people, you want to consult with your eye doctor. And then again, we have eye care deserts, as well as other subspecialists like Dr. Thompson. In the Chicago area, the South Side of Chicago is almost an eye care desert. Otherwise, you have to go to, you know, these large universities, teaching hospitals, whatever, to have access. And it's not even just a subspecialist. And so you have to be kind of careful, and you got to do some homework and reach to people. And in eye care also, people that might have a vision plan or vision insurance might think that does everything related to eye care, and it doesn't. Your vision plans just cover your basic exam for glasses or contact lenses and don't allow for more in-depth analysis if you're living with diabetes, if you have autoimmune disease, things, hypertension that need to be followed a little bit more frequently. Yeah, they might allow, and some providers may dilate your eyes, but you need imaging and other special testing to really track any changes or progress over time. So that's a misconception. So we also ask, what's your medical insurance and what's your vision plan? Because if there's some things we need to look into deeper, that's going to fall under your vision plan and that testing.
Yeah.
Another
I want
misconception.
to piggyback real quick, Dr. Johnson. So I'm 46, but till I was 41, I never had a doctor ask me, did I want an eye exam? Ever. Not one time.
Yeah.
So right there, so I've always had healthcare. I've always been in an area where I was not in. How are we going to, like you said, if you're talking about Southside Chicago, I'm quite sure this happening too here in Minneapolis. If that's happening with someone that has healthcare, that has access, how does that even look for a Black man? We're like, what do you mean I'm supposed to get my eyes checked, or I'm supposed to get that checked if I wasn't even asked? I realized I was like, I've never been asked. I never, they do like this, but I never had a full exam and gotten to anyone till I was like 41, 42.
Well, what drives some people into the eye doctor is the early to mid 40s, the small print is an issue. So they're pushing things out. So people are like, oh, something's happening. So that a lot of times drives people into the eye doctor. But again, we need to intervene much earlier. And
Absolutely.
it's panels like this that educate the public. Oh, I haven't had my eyes checked in 5 years. I haven't had it checked in 3 years. Um, Man, my grandma went blind. Don't know what it was from, but I could see. You better get in because there's possibly a family history of something. So I see all adults, children every year, and whether you wear glasses or not. So the whole purpose of the eye exam is eye health assessment as well as to assess whether you need prescription eyewear. And there's a whole nother world with that, with people buying glasses online, which can work out for some people in terms of saving costs, but that's a limited sort of thing with people buying uh, contacts online. And what was happening, they buy stuff online, they pass the expiration date, they just keep sending them contacts, but yet they have an issue like glaucoma or diabetes, and because they can see, they're passing that up. So we have to make sure we have a person face to face. They're doing virtual eye exams, but you're not going to be as thorough. They can take a picture, but you still need the guidance they're just catching the train wrecks, really.
Right.
In terms of managing our health, we have to take ownership and be more for it to know I need to get this done on a regular basis.
Right. So let's go into this. With so many historical challenges and that we've had overall as Black people, right? From tests being done on us, from them saying that we have a higher tolerance for pain. How do all three of you as health professionals get people to trust you that are Black folks? And all three of you, this is for all three of you.
Well, I'll say that first I try to address that and see if there are questions about it, because sometimes they're not accurately informed. For example, some people with the Tuskegee, with that Tuskegee experiment where they withheld treatment to Black men despite having a remedy emerge for syphilis. Some people are on the, they come in the office and they don't want to get vaccinated, and they say, well, remember how they experimented on the Black men and they gave them these medicines, and no, they didn't. The fact was they didn't give them the medicine, and they continued these experiments despite there being medicine available to cure syphilis, and then their family members got infected. So I first tried to make sure I know about the history, and then I tried to inform them about not only the more accurate story that happened, but also the consequences, which they're now review boards. There are more Black people in research. There are more checks and balances now out of from that occurring. Same thing with Henrietta Lacks and her cells. So I try to inform them so they can make an informed decision about their health care, whether it's vaccines, whether it's procedures, whether it's medicine for high blood pressure, because there is a lack of trust when you have those historical factors. But when you engage them and you embrace it, you explain it, you listen to what they have to say and where they're coming from, it's easier to address it and then inform them so they can make a rational decision.
Thank you. I love that. Lucienne?
Yeah, I mean, one of my mottos is that I meet folks where they're at. So I think a lot of times for me, especially being in the gym, I like to just give people space to show up and to listen. And for a lot of Black men, that takes a little bit, right? To know that you're safe, to know that you can be vulnerable and it's okay. To be 100% honest, while a lot of people would believe that they're coming in for the workout, a lot of times I find that I'm just spending time helping folks learn how to breathe, get in their body, might stretch and go through a movement that they haven't gone through in a number of weeks or time, especially my guys. And having that space to have that time, because there's nothing in life that gives them that. It's just go harder, provide, work, so like I said, a lot of times I find myself focusing on the breathing and just facilitating space. I'm also a believer that a lot of how we heal, a lot of how we work through the experiences and the traumas that we've had is through movement. And a lot of times you can't put words to that, right? But again, it's just facilitating that space and allowing people to show up.
Right. And I want to say this as I've watched Lucienne. I know a Black man to trust a Black woman in a gym, not just with their body, but with their thoughts, right? They're coming in there from those hours, 6 a.m. to 10 a.m. and they're dealing with stuff, and they give it to her to help them figure out, I think says so much about our Black community that's coming together, which has been torn apart, that the Black men and Black women are trusting each other again and being vulnerable. So I appreciate that space that you give. I know you've given it to my fiance, my son, and other Black men. They were all surrounding her today. But they trust her. They trust her,
Yeah,
right? They
to be
trust her.
honest,
Yeah,
yeah, I
they
bet
trust
even
her.
if like someone that isn't a client of mine, if they feel comfortable, if a man comes up and is
Mhm.
comfortable enough to share something with me to have a conversation, honestly, I take that as a win. Because again, those are the spaces that we don't have a lot in life. Like life doesn't give us this time to slow down and have those quality relationships, those connections. And so I'm grateful for that.
Yeah, thank you. Dr.
Yeah.
Johnson?
Wow, I was just getting a lot out of listening to everyone in terms of establishing trust. One thing I tell people straight up, studies show that Black people do better with Black doctors, period. That's indisputable, period. And also, I give people a chance to get their questions answered. I said, I don't mind questions. And I also say that if you want a second opinion, I am personally not offended. So I've been told by a number of patients, they went to the doctor and they questioned and they got all offended and, like, how dare you question me? And I said, then it's time. I don't care what kind of internist, general practitioner, or subspecialist, you need to go find another doctor. If they can't answer your questions, this knowledge is not in a vacuum. So I tell them up front, I don't mind second opinions. So if you want to question one, all I can do is just give you the information. And then I want you to make the decision on what's best for you. Because the bottom line, you're going to go with whomever you trust. And if you trust someone else, I'm not offended because then you're at least showing that you're taking control of your healthcare. So that's one thing. And I share with Dr. Thompson and the health professionals in Healthy Living with a Vision Foundation. We have what I always call street cred. I can't walk in church and see my patients and mistreat you. So I have that accountability because we're in the community right with you, going to the grocery store, gas station, church, wherever. So that kind of, that puts us at a little different level. I think so.
I'm here for the street cred. I like that. Yeah.
Yeah.
And it's true. It's true. With Black people, we need to know who you are outside of there. Like who you hang with, where you going, and all that stuff. And so if they can to be relatable and to humanize that healthcare system, I think it's detrimental to our health and how we can look at it a different way. So let's go into this now. The old just pop a pill or put you on medication, right? As someone that's in a holistic approach to healthcare, I don't ever feel that's the first answer. As Dr. Thompson said, when he start really honing in on his, food and the diet and the movement, what changed over the pills. So I have a family. I'm not going to say names, my mom and dad, that love that love pills. They like anything the doctor says, well, they said I should be on this pill. And I'm always like, oh my gosh, like, and it's a whole thing of why I started my businesses about this, right? Because of pills. I saw my parents together, you guys, they take over 100 pills. I take zero. I take a woman's multivitamin. And when they told me I was borderline, had cholesterol, high cholesterol, that's all it took. Because I go, what happens next? I go, we have to put you on pills. And I was like, oh, nope, that's it. And so here we are now. We are in the land, the world of pills. How do we get to our people? Because we think that that's going to help, right? And so I'm going to start with you, Dr. Thompson, because you started with your own body, right? Taking away the pills and honing in on that food, which I love that. Yeah, okay.
Yes, great segue. Yeah, people, we're in a era now where people expect a pill for every ill. And there's a problem with that. And I explain to people not to try to scare them, But I just ask them sometimes, if you have an alternative to this, which involves changing, modifying your diet, doing some more exercise, looking at some other things you can do, don't you think that's better than being dependent on medication, which is going up higher and higher and being covered less by insurance every day? So I'm getting more and more people to listen every day because they can't afford these pills. These pills are just, even with generics. And then every time you look around, a pill's being recalled. You might have been on the pill for 10 years and they say, oh, this pill's recalled now. It can cause some liver problems. I mean, you know, and for me, my motivation was I had side effects from them. And a lot of people have side effects from these medicines, from the statins and from some of these blood pressure medications. And so I tend to hone in on that. I said, you're not going to have side effects from broccoli. You know, you just usually are. You may not like broccoli,
You might
maybe
be a
it
little
may,
gassy.
maybe, but that will go away
Yeah,
fast because if you're
yeah, yeah.
gassy, your bowel is just not healthy. And then you can choose some other cruciferous vegetables. There's so many of them. Take your pick. But the key is that you can lower your blood pressure with changing your diet and with exercise. And I try to get people to just embrace the concept that you have to look ahead too. Rising prices of medications, procedures, less insurance coverage, donut holes. People when they're Medicare, they listen now. I'm on Medicare myself, but they listen to Medicare and they talk about those donut holes and they were supposed to disappear, but still these medications, you have these deductibles and all these things. It's hard for them to understand, but the bottom line, it's money out your pocket. So when you put this in the context of more money to go for other things you like to do or pay for other expenses, sometimes that can resonate.
I love that. Yeah, they have a pill for everything, every single thing. And that there's what you said, there's no profit in the cure. Yes. There I haven't heard of a pill for eyesight. Is there, Dr. Johnson, or are people believing that there's a pill for eyesight? I know laser is a big thing. Um, and then Lucy, and you deal with surgeries. People rather go have surgery and all this stuff and don't want to deal with the real health ailments that they're dealing with. So, Dr. Johnson, is there? I'm asking, being serious. Is there a pill or something that people are saying that they've seen? Okay, there is. Okay.
One of the things that another misconception is laser. Well, can I just have laser surgery to fix my vision? No, it is not a one stop shop for fixing your vision. There are limitations to laser vision correction because you are cutting on reshaping healthy tissue. And as you get older, it doesn't fix the issue where we'll need to read small print. So a lot of people with real thick nearsighted prescriptions, I see as a good option for those individuals because it's a safety issue. They waking up in the middle of the night and they can't find their glasses or contacts or whatever. They feel very, very vulnerable. But for people with low, medium prescriptions, you know, I'm not a big proponent of that. So it can be a cash cow for certain parts of the industry. And then some people, I do think it's a viable option. Vitamins, supplements, I am very open to supplements. I take quite a few myself, but a lot of it can be helped with a healthy diet. But the other reality of it is our foods, our vegetables now don't have the nutritional supplement levels that they did 20, 30 years ago because of the soils being constantly farmed and over farmed. So that's documented that, the our vegetables may not be as potent in terms of the nutritional supplements that are good for the eye and other parts of the body. But brightly colored vegetables, green leafy vegetables, provide those nutrients that help the eyes, help improve color vision, contrast sensitivity. And so a lot of cases I will provide those supplements to people. Things like wild caught salmon and other cold water fish provide a good quality omega-3 fish oil supplements, or for people that are vegan, flaxseed oil can provide those things that help reduce inflammation, not only in the eyes, help dry eyes, but in the body overall. So short answer is yes, there are supplements or things of that nature. They're showing that macular degeneration can be postponed or stabilized with nutritional supplements. So yes.
Mhm. Lucy, can you answer that? And then we're going to go real quick into mental health in our last 5 minutes.
Yeah, and I'll kind of lead into mental health with my example.
thank you.
It's hard because in my line, a lot of times we get focused on just the aesthetics of things. But really I try to bring folks back to the fact that like waking up feeling normal, whatever we can, label normal as, is really underrated. And so like to wake up and be optimized, my mind, my body, my spirit, is almost like unheard of because of the amount of things that we have to counteract in our environment constantly. So like even thinking about mental health and thinking about like depression and anxiety, our bodies aren't deficient in Prozac. Our bodies are deficient in the things that they need, like movement, proper nutrition, quality relationships, connections. You know what I mean? So it's rare that it's not that you needed the pill, it's that you need more of the things that our day-to-day life pulls us from. Our day-to-day life pulls us from, being able to be active, from, having the time and energy to get good quality food. And just as Dr. Johnson was saying, I talk about this with a lot of my clients when it comes to like the supplement talk, because one of the first important things that people want to get off their chest is like, all right, what supplements should I take? And the first thing I say is, or remind them, is that the purpose of supplements is to supplement something that you are not getting through your food. So
Right.
if we're getting a whole diet, ideally we don't have to go overboard on the supplements, but it's also helpful to acknowledge things, again, like Dr. Johnson said, where like our soil is just not mineral rich anymore because of our agriculture world. So even to look and go get the data, am I deficient in magnesium? Do I need zinc? To know exactly, where it is and what you need. I think bringing up the awareness, again, back to the empowerment part, just empowers us to make better decisions and question things a little bit more, ask better questions.
Yes. So thank you, Lucy. We just have a few minutes. So I do want to talk about mental health briefly. I know this is like going to be the brief because I think that is like at a height right now with Black people. We have seen so much over the years, but really over the last 5 years, it's really taken a toll. And we're finally addressing that we as Black people, it's okay to not be okay. It's okay to talk about that you're not okay. It's okay to seek medical help. And, for my mental health, workout and that clean eating does a lot, right? You release a lot of that stress we're talking about. You're going to release that inflammation. You're going to lose pounds and build muscle instead of that. So, if you all in like 1 minute each could say something you would give to patients or clients about their mental health before all of the other things we're talking about come into play. Whoever likes to start. You only got a minute each. Dr. Johnson.
I want to talk about mental health because when I talk about the overall health, a lot of times it's overwhelming. With people living with diabetes have a higher instance of depression because I got to take my medicine, I got to lose weight, I got to eat right, I got to exercise, and it's overwhelming. And we always talk about what you can't do, and I like to focus on what you can do. So it's all, the eye stuff is all connected, and people have vision problems because of stress also. We're on a computer, we're on Zoom meetings and things of that nature. That causes stress. So the proper eyewear is so very important to relieve eye stress. And a lot of us men, we just get the over-the-counter readers and wonder why our eyes are still getting tired because that vision is not corrected for properly.
All right. Dr. Thompson.
Yeah, mental health is a soaring issue for Black men and Black people in general. For some reasons we've already talked about this, the background stress we have to cope with, the impact of pandemic. The pandemic is still far-reaching for Black people, disproportionate for Black people. And so, and yet we live in an era where many mental health institutions have been defunded. They've closed up. There's, with the closing of a lot of mental health institutions, we've seen a surge in incarceration. And so, therein lies a problem. Also, the problem is only about 2% of psychologists and psychiatrists are people of color. So that's another battleground. And, we can take, as a practitioner, I try to be more attentive to that and guide people towards some people I know, people of color that are in that field that can be of help, and try to also address the stigma that isn't just from the health professional, it's from our Black men. Our Black men think it's a weakness to admit or talk about those kind of things. So we talked about creating a comfortable space. I try to create that space where we can have that discussion and we can talk about what are the positives about getting some counseling. And so that's how I address it.
Counseling's your friend.
Yes.
Lucy, will you wrap us up?
Yeah, I think I again, we kind of threaded this through. I'm just happy that we're having the conversation because I think if there's any group of people that need to consistently be reminded that their mental health is important and needs to be recognized, it's Black men. I was working with a client this week that after our session, he texted me and was like, I think you might actually be my only friend. Thank you for listening to me. And that broke my heart. Obviously, as adults, we move away from a lot of the social groups that we have when we're younger, teams, groups, clubs, that kind of thing. But to think about someone being out in this climate in the world that we live in, let alone a Black man, and not have a friend or someone that and again, this person is very well connected, has lots of relationships, but not one of them that you feel like you can open up to and be yourself and call a friend. I think again, that's where we start. And so bringing more attention, I want men's mental health, Black man's mental health to be talked about as much as Pride Month or something. It needs to be that talked about. And the ways that it looks can be different. So somebody might not be comfortable with going in to sit down and talk to a therapist for an hour, but if they're comfortable going in and seeing a trainer and having a quality relationship, real connections, maybe that's what it is. Maybe it needs to look different than the traditional sit down on a couch across from one another. But I just don't think it can be emphasized enough and continue to be reminded.
Thank you. Love that. Please give it up for Dr. Thompson, Dr. Johnson, and Lucienne Olson. We appreciate all your expertise and all of your knowledge. Keep doing what you're doing in the healthcare world and in the gyms and showing up for all of our Black folks. If you guys have questions or want to reach out to them, can you guys each put your contact information in the chat if you're comfortable with that, how they can reach you, whether it's your facility or your business. We just want to thank you to the audience for coming in, learning and listening. I hope you apply some of these Black facts back into your Black life and be Black excellence with all of this. It's always a great conversation. I took some great jewels away that I'll be incorporating. Keep healing from the inside out. Lead with empathy and love. And I'm going to turn this over to Miss Deborah.
Thank you so much, Shay, and I want to thank you and all of our speakers. This was an absolutely phenomenal discussion that touched my heart. I have a lot of Black men in my life who are facing some challenges, and this information was very, very good. When I started this out, I said that ABEP makes the connection between health and economic power. If we do not have our health, we cannot have real economic power. We have to remember that they are so interconnected. So I want to encourage everyone who knows a Black man to boost him up, to take an active role in his health. For this program and the entire Journey to Your Financial Future, I want to thank my staff for helping pull this together, Shay for stepping in and hosting the series. We really appreciate it. And also I want to thank our sponsors. And if Aida could bring them up, this group of supporters help us make this possible. And we also do live audience participation programs too. And we'll be, if you attended this event, you're going to be on the list to get the invite for the upcoming events as well. They take place at the ABEP office, and you are absolutely welcome to participate. And if you have any questions for ABEP, please don't hesitate to reach out and contact us. Thank you.